Hi, this is Andy Schumann from MedGizmos. One of my top 10 applications for pediatric practice is Pediatric Symptom MD because it presents excellent advice for answering those questions that confront and confound many parents. I keep it on my iPhone so I can demonstrate its use at preventative care visits. It was developed by Dr. Barton Schmitt, who wrote the first book on telephone triage in 1980. Dr. Schmitt is currently the Medical Director, Pediatric Call Center, Children's Hospital of Colorado, as well as Professor of Pediatrics at the University of Colorado School of Medicine. Dr. Schmitt's telephone triage protocols are used by call centers and medical practices across the country and throughout the world. Pediatric Symptom MD is an outstanding application because all information presented is derived from Dr. Schmitt's protocols. Pediatric Symptom MD includes several modules, including a symptom checker, medication tracker, first aid section, and a parent advice center. I am pleased that Dr. Schmitt agreed to present and discuss his application with us today. Here is Dr. Schmitt discussing the symptom checker module of Pediatric Symptom MD.
Hi, this is Barton Schmitt. I'm Professor of Pediatrics at the University of Colorado School of Medicine. I'm also Medical Director of the Pediatric Call Center at Children's Hospital, Colorado. My topic today is the Pediatric Symptom Checker. Its purpose is to help parents decide whether or not they need to call their pediatrician, and if not, to take care of their child at home. I wrote the original version in 2001 for pediatric websites, and we created the app version for smartphones in 2009. It's derived from the protocols used in pediatric call centers and pediatric offices across the country, and it's updated yearly. Let's get started. The first screen that comes up in the Pediatric Symptom Checker is the search engine, and you can search by typing in a keyword, or you can search by alphabetically. There are 140 symptoms or diseases in the symptom checker that can be searched on, or we can search anatomically. And before I go into the avatar, you'll notice in the lower right there's a button called Skin, and that contains the 50 care guides for decision making about conditions that occur on the body surface. But back to the anatomical search, and let's pretend our patient has a stomach ache, and we'll go into abdominal pain female, and that each symptom has 4 tabs on the upper screen, as you see, and the first one is definition, and if the child's symptoms match this definition, the parent is encouraged to move straight ahead, but if not, they need to reconsider if it's something more specific, such as urination pain, constipation, etc. But let's say we're in the right guideline, and let's begin our tour. Clicked on the second tab on the top, when to call, and the parent is instructed to go from high acuity to low acuity questions or indicators, and as long as they are negative, to keep moving, and but to stop the first time they get a positive. Eventually they get to the yellow zone, which are patients that should call you during the next 24 hours or during office hours. And I should say that every guide ends in a self-care at home sanctuary. And if we click on that, and let's assume all questions were negative, this is a mild stomach ache. This takes us to tab 3, which is care advice for stomach aches. This is detailed care advice. It's identical to the care advice given out by nurses in after-hours call centers. It's identical to the care advice given out in the American Academy of Pediatrics Pediatric Telephone Protocol book in offices. It's in many handouts. It's updated yearly. It's almost standard of care. It always ends in what to expect and a contingency plan about when to call your doctor if things go badly, unexpectedly. There's a 4th tab at the top that many parents don't realize is there, and it's share what you're worried about with your babysitter, with the grandmother if she's taking care of the kids, with your sister-in-law if she's constantly calling you about her firstborn. I'm going to send this to myself. There is a button at the top right called send, and I have just sent that. It's on my email at the hospital. I could have sent it to the patient's portal, or at least the parent could have done that. Finally, let's talk about how to present this app in your office. Somebody needs to demo it. Who should that be? I think train your medical assistant or your nurse how to demo this to parents. When should they demo it? Best time is after the patient has been placed in the exam room. There is some downtime before you show up. And what should the parent be asked to review after they've had it demonstrated to them? Ask them to review what they are there for. If they're there for a sick child visit, if they're for a well child visit, ask them to think back about the last time their child was sick and review that symptom and that experience and see if they could have managed this safely at home. Again, this is a pediatric symptom checker app that can provide 24/7 access to expert, up-to-date pediatric advice